Okay, so we're going to perform manual muscle testing for shoulder flexion. At this point, I would have already screened for active motion, and if she had full active shoulder flexion against gravity, I know that places her at least at a grade of 3 out of 5. So we're going to test for grades above 3 by placing her shoulder at mid-range, so approximately 90. I'm going to stabilize her scapula, and I'm going to apply downward pressure at the distal aspect of the humerus, taking care not to cross the elbow joint. So I'm going to press down as hard as I can, and you're going to not let me move your arm. Are you ready?
Ready.
Okay. 1, 2, 3. Good. So she was able to tolerate maximum pressure. You can rest your arm. If at maximum pressure, that would put her at a muscle grade of 5. If she was only able to tolerate, or she broke at moderate amounts of resistance or pressure, that would put her at a grade of 4. And if she was able to tolerate only a minimum or a slight amount of pressure, that would put her at a grade of 3+ over 5. For the grade for a grade of 3-, if she was not able to achieve at least on her active motion 50% range of motion, if she was only able to achieve less than 90, that would put her at a grade of 3-. Okay, so we're going to test shoulder flexion in side lying, where we can minimize the impact of gravity because she is not able to move well against gravity. I'm going to support her arm. Just relax a little bit right here. I'm going to stabilize just a little bit at her scapula, and I'm going to ask her to move into shoulder flexion. You may have to coach this a few times with your patient to begin with, because bringing their arm up now is a little bit more confusing for what direction we want them to go. But she was able to move into, this is her motion, full active motion into shoulder flexion. So now we're going to try giving a little bit of resistance. So here at mid-range, I'm going to apply some gentle resistance with my right hand. Don't let me pull your arm down now, okay? Good. So she gets a score of 2+ because she could tolerate slight pressure. If she could not tolerate that pressure, but she'd already demonstrated gravity minimized full motion, that would be a 2. If, however, from this starting point, she was not able to move through full range, we'd score her at a 2-. If we weren't achieving motion, then I want to palpate on that anterior glenohumeral joint as I ask her to move her arm into shoulder flexion. If I do feel a trace of motion, if I feel a flicker of muscle contraction, or if I can see it, then we'd give her a 1. If there's no palpable or visible contraction, that's a grade of 0. Okay, for shoulder extension, I'm going to have her reach her arm to about mid position for shoulder extension. I'm going to stabilize anteriorly on the head of the humerus. I'm going to apply resistance at the end of the humerus, not crossing the elbow, for 3 to 5 seconds. Don't let me pull your arm down. Are you ready?
Ready.
Good. So again, at maximum resistance should have a 5, at moderate resistance a 4, minimum or slight pressure tolerance would be a 3+, and again 3 with just full active range of motion against gravity. If she could only move 50% of that range or less, then we'd score her at a 3-. For shoulder extension, we've got her laying in side lying to minimize the impact of gravity. I'm going to give just a little bit of stabilization here at her anterior shoulder, asking her to move into full extension. If she has full range of motion there, I'm going to get her midway, and I'm going to use my left hand to apply slight resistance. I'm going to try to pull your arm towards me. Don't let me. Good. So she was able to tolerate a slight or minimal amount of pressure there, which would put her at a score of 2+. If she couldn't tolerate that resistance, then she would only be at a 2. When I asked her to move, if she was only able to achieve part of that motion, then we'd put her at a grade of 2-. If I'm asking her to move, nothing is moving, no joints are moving, I'm gonna palpate on that posterior aspect of the glenohumeral joint, and if I feel a bit of muscle contraction or if I'm able to see it, then we'd rate that at a 1. If there's no palpable muscle contraction, we would rate that at a 0 for shoulder extension. Okay, for shoulder abduction, we're going to have the forearm in a neutral position. Again, the shoulder is going to be at mid-range. I'm going to stabilize on this contralateral shoulder, applying pressure at the distal humerus, not crossing the elbow. I'm going to put downward pressure and try to push your arm down. Okay. Don't let me move you. Are you ready?
Ready.
Here we go. Good. Maximum resistance tolerance would give her a 5. Moderate, if she broke it moderate, that would score her at a 4. Minimum or slight at that 3+. If all she had was against gravity, a score of 3. And then of course, if she couldn't achieve 50% of the range of motion, that'd put her at a 3-. Okay, so testing shoulder abduction, less than a grade of 3-. We've got the patient in supine in order to minimize gravity. I'm going to support her arm this way. I'm going to give a little bit of additional stabilization on the superior aspect of the glenohumeral joint. Take note that her forearm is still supinated to decrease chances of impingement. Now you're going to bring your arm out to the side. Yep, keep going, keep going. Can you go all the way up? She does go to full range of motion. So we're going to come back halfway. And now I'm going to hold your arm here and give just a little bit of resistance. And I'm gonna stabilize here still at the superior aspect of the shoulder joint. Don't let me pull your arm down. Good. So my resistance is being applied right here at the elbow, and you don't want your resistance to be beyond the elbow. So make sure your hand position is good. If she tolerated that slight resistance, that would be a score of 2+. If she did not, but she had her full range, that would be your score of 2. 2- would be if from the starting position, she was only able to come partial range of motion. If we're not having any motion in that shoulder joint, then I'm going to palpate on the superior aspect of the glenohumeral joint. If I can feel some contraction or if I can see it, that would be a grade of 1. If there is no palpable or visible muscle contraction, then I would give her a grade of 0. Now we'll test shoulder external rotation against gravity. So ideally, best practice would call for you to put your patient in prone to achieve this. You need to have some towels or a wedge or your own hand to support the humerus so that you have good alignment with the scapula. I'm going to ask her to move her forearm into external rotation. And she has good full range of motion there. So now I'm going to get her back down around 40 degrees of external rotation. The application of pressure is actually going to be at the distal forearm. I'm going to provide some stabilization up here at the scapula. I'm going to try to push your hand down. I want you to resist. Don't let me move your hand. You ready? 1, 2. Good. So if she tolerated maximum pressure there, that would give her a grade of 5. If her forearm dropped at moderate amount of pressure, that would give her a grade of 4. 3+ grade would be if she could only tolerate or if her arm dropped with a minimal amount of pressure. If when we started this motion, she had full motion but could tolerate no resistance, that gives her a grade of 3. When I ask her to move against gravity, If she could not achieve that 50% of active motion, then we would give her a grade of 3 minus. If she could not achieve that much range of motion, then we would want to put her in a sitting position so that we could test her in a gravity minimized position, and that's what we'll do next. Okay, we're gonna measure external rotation for those lower muscle grades in a gravity minimized position. So in this position right here, we have gravity minimized. We want to keep that humerus adducted, and we're going to keep that forearm in neutral, and I'm going to ask you to show me how much motion you have in external rotation. And my left hand here is just there to kind of provide support if needed. Okay, so she's got full range of motion in a gravity minimized position. And so now I want to get her partially through that range again. I'm going to have her hold right here, and I'm going to see if she can tolerate a slight bit of pressure right here. I'm going to try to push your hand in. Don't let me do that. Good, she did. So with a slight amount of resistance there, we'd score that at a 2+. If she could not tolerate any resistance, if I apply resistance and she breaks, then we'll let that be a score of 2. If, however, I'm going to ask you to move through that range of motion, but she's not able to get there only partially, if that's about all she has, we'll score that at a 2-. If she's not even moving there, I want to, with this hand, palpate where those external rotators are on the posterior aspect of the shoulder, and I'm going to ask her to move her hand and forearm into external rotation again, and I'm palpating to feel for a muscle contraction. I want you to try to move into external rotation. If I can feel a contraction, or if I can visually see a contraction, we would score that at a 1. If there's nothing palpable and I cannot visually see a muscle contraction, then we would score that at a 0.